Corona is here to stay. So as we live in this life along with Corona, there are so many myths and facts which we try to break. What are these things? And what do people say? When they come to us, they have lots of questions to ask. And we will be struggling into answering what it is, what are recommendations and what are the guidelines. So let me tell you, the first myth which came when Corona came, especially when it comes to women, is they cannot take during menstruation. Is it true? Is the immunity going to come down with Corona if they take the vaccine during menstruation? That's an absolute myth. The CDC has clearly told menstruation has nothing to do with vaccination, and there is no proof that immunity is going to come down in the first half of the periods. See, what we need to understand is whenever we take a vaccine, there is an antibodies which are being produced which is above the threshold level. At any given time in a menstrual phase or any during the follicular phase of the life, a woman's immunity is not going to come down. So all you girls out there, whether you are menstruating now or whether in the ovulatory phase, just go and take your vaccine. Next question comes when they come to us. Which one is good? Should we take that vaccine or should we take this vaccine? And we are planning for pregnancy. Can we go ahead or no? Or we are going for IVF. So can we become pregnant or not? Or I just became pregnant. What to do? So what we need to understand along this is everything. Vaccination and your regular medication is like two trains per triumph. Both the things can go parallelly. You are thinking of pregnancy, please go ahead. If you become pregnant, please continue. But vaccination is something which is the must when it comes to pandemic. Take your vaccine. Vaccine do not have a live vaccine, live virus in it. What we are giving is either an attenuated vaccine or what we call it as a vector vaccine, which will have a adenovirus, which is a very mild virus, which will take along it, piggyback on it, the spike protein of the virus, so that we develop only antibodies. Antibodies are not harmful. Corona is harmful. That is the reason. Whether you become pregnant or you're trying for pregnancy, whether IVF is there and your embryos are there, you want to go for embryo transplant, don't worry about it. ET can be done. Anything can be done. But what we need to understand is that Corona is definitely harmful. Vaccination, is it harmful? Corona, is it harmful? Vaccination, absolutely no proof that it is harmful, and it has not given any effect on the baby, any anomalies on the baby, any side effects on the mother. But Corona, if it affects a mother, a pregnant woman or a lady who is lactating, where the immunity is low, 20 times more increased risk of morbidity and mortality. So which one is the thing? Dol mol ke bol. So definitely vaccination is a thing which everybody has to take. Like I said, recommendations are something, whereas the permissions are something. In pregnancy, what do we say? The Gynecological and Obstetrics Society all over the world and us in India, we all recommend that all the pregnant women and the lactating women should be taking vaccine, underline, should be taking vaccine because it is more detrimental to have Corona in pregnancy as it leads these women to go on to the ventilator and death rates are high. But permissions when it comes, the government permissions are yet to come for pregnancy, but we need to live first to think of permissions and guidelines later. So all you women out there, off-label usage as of today is in pregnancy, just go take it. In off-label, we do use so many things. Next comes the lactation. मैं दूध दे रही हूँ, 8 महीना का बच्चा है, अभी डिलीवरी हुआ, is this a time to take or immunity is going to come down if I take? Is it true that if I take a vaccine today, in the first dose हो जाने के बाद immunity कम होता? Again, all these things are myths. Luckily for us, government has given permission to be giving the vaccine in lactation. So fear not and just go and take your vaccine in pregnancy and in lactation. Saying all this, there are two more questions which I want to answer before I stop this. The first question would be, which is good? Is it Covaxin? Is it Sputnik? Or is it Covishield? We have these three vaccines here. We are beggars. Beggars are not choosers. Right now, survival is the first thing. We need to just take whatever is available to us. But what we need to understand is none of these MAC vaccines have live Corona in it. So just go out there and take it. You have pregnancy, you are lactating, you have a coronary artery disease, you are on blood thinners, you are having asthma, or you are having an autoimmune disorder, anything, just go and take your vaccine. That is the priority, which is very important, irrespective of whatever vaccine is available. Next questions come. I took the first dose. Next, I got the infection. Then what to do next? Should I go ahead? Or why did I get the corona infection when I took the vaccine? When should I take the second vaccine? So let me tell you that when you take a vaccine, it takes 3 weeks to 6 weeks for the antibodies to form. इतने में आगे जाके आ बैल मुझे मार बोले तो बैल आके मारेगी. So you go and expose yourself to the infection, virus is going to come. So what we need to understand is that vaccine is like an umbrella. It will save you from getting drenched when a storm comes. Means you go out in the rain without an umbrella, you are going to be drenched. If you take a vaccine, it is going to save you. It is going to act as a shield. So you still have to wear your mask, you still have to be maintaining the social distancing. So your social responsible corona behavior as a citizen should continue along with the vaccine which you are going to take. That's when it's going to save you once your antibodies are going to increase. The best part of the antibodies is that once you form the antibodies, they're going to go along the placenta and along the milk also, and it is going to save you and your baby from getting infected or from going on to the ventilator. And if you get the infection, wait for a minimum of 1 month before you take the next dose. So all these are the facts which you all have to understand. So what you understand now is the safest thing available now is the vaccine, and the most unsafe is corona. And the way corona is going to affect you, nobody knows. Whether it is affecting somebody else, somewhere else, science is not like maths. Every finger is different. So you might be the next one who is going to be infected and going on to the ventilator. So save yourself first. You can save yourself, then you can save the house and environment and the country. So be a responsible social citizen. Have a behavior which is corona friendly. Avoid yourself from getting infection and protect the others too. But it is the vaccination which is the primary prevention. Next comes the mask and the social distancing. So all the best for everybody out there. Go get vaccinated.